Good afternoon. Across the world, there are more than 1 million cases of COVID-19. We see to the south in the United States, large number of increasing cases. And across Canada, there have been over 11,000 cases of COVID-19 and 138 deaths. The number of hospitalizations in the country continue to increase. Today, there are no new cases of COVID-19 in Prince Edward Island, so our total remains at 22. 4 people are considered recovered. We've done more than 1,000 tests here, and close to 140 of them done yesterday. I expect and hope to have additional test results later on today. As we mentioned yesterday, we are now doing some testing here locally for specific populations like certain healthcare workers and individuals in long-term care. And we've done a small number of those, and we'll be increasing that capacity for local testing, trying to double that capacity every 3 to 7 days. And of course, any positive cases that are determined here will need to be confirmed by the National Microbiology Lab, but and we'll speak more about that when that occurs. We want to speak about self-isolation and the importance of it, and we talk about it every day. But I need to be clear, if you're not complying with the measures of self-isolation, you are putting yourself and others at serious risk, and you can be fined. Our enforcement colleagues continue to issue verbal and written warnings for violating the public health order. Calls continue to be made, and we continue to take calls using the toll-free 1-800 COVID information line, and encourage those who wish, please use that line and we will call you back. 811 has even more people hired. Close to 80 additional staff have been hired, and increased training is occurring. Although, of course, we're very focused on COVID-19, I'd like to be clear that anyone requiring further medical attention for other conditions should call 911 or visit the emergency department. And this is especially important for people who may have underlying health conditions or such as heart disease. We certainly are concerned that we would miss something like a myocardial infarction or a heart attack if people do not seek the care they need if they have symptoms. As we head into another weekend, I'd like to re-emphasize that just because we do not have a new case today, that does not mean we should be complacent. In fact, it is the time that we need to be just as vigilant as ever. I expect the number of cases in P.E.I. to increase, and I expect that we will see cases in Prince Edward Island that will result in hospitalization. And that is why we're working so hard with these public health measures and health P.E.I. to prepare our system. And it's important that we continue to self-isolate following travel, practice our physical distancing, and be diligent with the other things we've talked about time and time again, hand washing, for instance. I know we all want to get back to normal, and I do as well, but now is not the time. All Islanders, please remain diligent this weekend. We need to make responsible choices, and that will impact us going forward. And I know it's difficult. It is really hard. And in many ways, it seems almost counterintuitive that we're asking people to stay apart. But if we don't make these difficult decisions and choices now, it will influence the weeks ahead. If possible, stay at home, maintain physical distance, and if you are self-isolating, do so. And a reminder, it's those returning from travel who need to self-isolate from out of province or out of country, if you're a case of COVID, obviously, or a close contact of a COVID case. Staying physically apart does not mean disconnecting. It means finding new ways to connect with people we care about and those we love. It can mean video chatting with friends, talking on the phone, going outside and enjoying some fresh air, especially if you can stay, if you're not self-isolating, staying close to home, baking with your children, doing a workout at the house, learning new skills. And Islanders are so resourceful and creative, and there's so many people offering great opportunities to keep people busy in their own homes. The better we are at implementing these measures, the better chance we have in P.E.I. not only to flatten the curve, but I'd like to think we could make it closer to a pancake. By doing something as simple as these measures, we can together save lives.
Other provinces are moving towards releasing modeling for outcomes. I know Ontario is releasing some projections today for projections for how the virus will spread there. I guess where are we at with projections of what that spread might look like here? And do you have a realistic ideal scenario in terms of how many cases we could see here, hospitalizations, and how long this could last?
Well, I think it's a really good question. We are working on modeling and for this province, and I think the different provinces in the country are different stages of this outbreak and this pandemic. So and I expect the federal government also to be releasing some modeling at some point going forward as well. We will be looking at projections how we look in projections to other provinces as well as other parts of the world. And so it's a little more challenging for us to do some projections based on fairly low numbers here, which of course we want those numbers to be low, but it influences some of those projection curves. The assumptions that are going into those kind of models are very solid, and we're working with a great team of modelers that are epidemiologists, and so when those numbers are available, certainly we will be discussing them more publicly.